Today we're going to talk about the different types of treatment for breast cancer. Doctor?
Well, Counselor, the treatments for breast cancer have not changed so much in type, but a bit in style and in the various modalities that are available within the categories that I'm going to go through. In general, it involves surgery, chemotherapy, radiation, hormonal therapy, and what are called targeted therapies. In surgery, the trend has been to less and less invasive and disfiguring treatments. The radical mastectomy of old is rarely employed now. Modified radical mastectomies and even more so lumpectomies are much more common nowadays because we're better able to image these masses and we're better able to know when we remove them just by themselves, preserving the breast tissue, that we've got all of the tumor. This would involve sometimes what's called a sentinel lymph node biopsy, where a biopsy of the lymph nodes up here in the axilla or armpit is performed to make sure that the tumor has not spread to that area, which would change your stage. Independent of that, there are a variety of treatment options that can be offered. Radiation therapy, utilizing external beam or implanted therapy, is still a very, very common mode of treatment. Chemotherapy has been around for many, many years, but the type of chemotherapeutic agents have changed dramatically as well as the options, and they are much less toxic than they used to be. Hormonal therapy is of keen interest because it tends to have fewer side effects. And it's based on the fact that breast cancers tend to have receptors for testosterone, progesterone, and estrogen, and if those receptors are blocked, those tumors will regress and actually die over time. And lastly, there's something called targeted therapy, where you have chemical agents attached to cells, and those cells actually have a tendency to cluster around cancer cells. And as a consequence, they literally will deliver a chemotherapeutic or toxic agent directly to the cancer and only to the cancer. And this is a very novel and promising way to treat breast carcinoma.
Thank you, Doctor.